Youth Movement Karnataka, which is actively working on youth issues and problems. We have a distinguished speaker today with us, Dr. Ali Khwaja, who has completed his BTech from IIT and Masters in Metallurgy. Then he has also pursued his PhD in counseling. He is a chairman of Banjara Academy and Honorable Director of Helping Hand. He is a life coach too. He has vast experience, which is more than 3 decades. He speaks in common man's language on myths and misunderstandings of mental illness and mental health from childhood to old age. So he is the author of 35 books, alhamdulillah, and around 92 booklets on topics related to human behavior. So I'll hand over the mic to Dr. Ali Khwaja Saheb. He is an amazing teacher. I was his student in Banjara Academy. I can tell you with 100% surety, by the end of this session, you will understand what actually depression is. Over to you, Dr. Ali sir.
Assalamu alaikum. Very interesting and a very neglected topic today. कई लोग इन अल्फाज से थोड़ा घबराते हैं. People don't like to talk about things like depression and all that because it's not a very, very happy thing to talk about, no? Anyway, let me start off with explaining that well-being, insani jazbaat or insan ka sukoon, can be divided into 3 parts. The first is physical health. आपका जिस्म अगर तंदुरुस्त हो तो आप जो चाहे कर सकते हैं. The second is mental health, and the third is spiritual health. पहला ले लीजिए आप physical health. Everybody knows about it. Everybody knows what needs to be done, how to take care of your health, how to prevent illness from coming, and by chance, if there is an illness, how do you overcome it? Whom do you go to? What sort of treatment you need to take? And then again, how to prevent things from happening. So we are all very familiar with physical health. The same way, spiritual health, deen, iman, our, understanding that there is a purpose and there is a direction to life. Usme bhi we have clarity, we have the scriptures, we have everything available to us. जिसके बिना पर हम अपनी जिंदगी गुजारते हैं. In between comes mental health. And mental health is the most misunderstood plus stigmatized. ये भी याद रखिए. If somebody asks you, you're not feeling well, you're coughing or you're running fever, and if somebody asks you, how is your health? He's obviously referring to your physical health, and you feel nice that the person has inquired about you, person is concerned about you. But supposing you're looking very dull, very down and out, and somebody asks you, how is your mental health? Immediately you'll probably turn around and say, Kyun? What's wrong with me? Kya main pagal hoon? What do you mean, how is your mental health? You know why we do that? Because we confuse mental health and mental illness. Mental health is not just absence of mental illness. The same way as physical health is not the absence of physical illness. Just because I do not have cancer or COVID or HIV today doesn't mean that I'm in perfect health, isn't it? I may be having some indigestions. I may be having migraines. I may be having lack of sleep or something. Now that is also the area of physical health. But the interesting thing is we don't hesitate to take help. We will go immediately to a known person, we'll go to a nutritionist, we'll go to a doctor, we'll go to somebody and we'll find out कि साहब ये हो रहा है मेरे साथ, इसका क्या इलाज है, क्या जरिया है, बताइए आप, and they help. There is no stigma, there is nothing to be scared of when we inquire. But supposing it is mental health, supposing I'm feeling very, very low, I've lost my motivation, कुछ काम करने को जी नहीं चाह रहा है, I'm feeling very, very upset, I don't know what to do, what not to do. Do I have that openness to say, there is something wrong with my mental health, I need help? No, most of us don't do that. And that is the reason why there is so much problem taking place in this area of mental health. Not because it's something very, very difficult or it cannot be overcome. Today, even the worst of mental illnesses, maybe except dementia and Alzheimer's disease, जो बुढ़ापे में आती है, leaving out a few like that, most of even the major mental illnesses, you have heard of schizophrenia, bipolar disorder, all these also are treatable and curable. But today we are not going to discuss those major mental illnesses. Today we will discuss the most common mental illness, and that is depression. Here again, there is a big question mark. I am in depression, I'm feeling depressed, but that doesn't mean that I have a mental disorder. You do. See, take physical health once more. अगर मेरे को 99 degrees fever भी हो, it is a physical illness. But I may say, yes, I have fever, I'm not feeling well. तो आज शायद मैं रेस्ट कर लूंगा. I'll take some crocin, paracetamol. I'll restrict my diet, I'll have some juices and all that. I'll take rest. By tomorrow, I should be all right. Supposing the fever is higher, I've got 101, 102 degrees. I feel नहीं, कल से fever नहीं उतर रहा है. Let me go to the doctor. So I have a doctor in the neighborhood. I go there and बोलता हूँ डॉक्टर साहब 2 दिन से मेरे को fever है, it's not coming down. He will check me out and he will prescribe some medicine, antibiotic, जो भी है. It takes 3-4 days and the fever comes down. Supposing I have 105 degrees temperature, it's a very serious matter. I should get admitted to hospital immediately. Otherwise, it can go to my brain and it can affect me. And we all know that. So, nahi, 105, 106 temperature, very serious. Take him immediately to hospital. Start off the treatment immediately. That is how we treat, isn't it? All three are fever, but we accept it. Now, the same applies to depression. I can have very mild depression. I was wanting, I'm working in some organization and I was wanting to get some contract. And that customer had promised me that he will give me the contract, but he didn't give it to me. I can feel depressed. That night I may not sleep. I may be tossing, turning. So, I was having so much hope on this. I was really expecting that something will come through. This would have meant a lot to me. I would have earned so much money. By morning, I'm up and about and I say, "ठीक है, that contract is gone. Let me look for another customer. Let me try something new." And I'm back to normal. That is like the 99 degrees fever. Sometimes I may have greater depression. I've had a loss. Somebody very dear to me has passed away. Or I have lost a major job. Or I've had an accident and loss of limb. Or there has been a break in a very important relationship. Now that won't go away in 1 or 2 days. That depression will last for a long time. But here again, the same thing. Okay, if I have good support around me, if I have family members, if I have close people who give me support, who are there to hold my hand and say, "We know you are going through a bad time. We understand that you're feeling very, very low, but whatever happens, we are there with you. Let us work towards it, and inshallah, you will be okay soon." Supposing the depression is much more serious. It's like that temperature chart I told you, from 99 to 102 to 105. It can go to very severe depression also. In which case, I do need professional help. Okay. Now, before I come to what exactly is the way of treating it, what are the ways and signs and everything, let me first clarify to you that sadness is not the same as depression. People confuse between the two. मैं अगर मायूस हो जाऊं, if I am feeling sad, that does not necessarily mean that I am in depression. As I said, no, I wanted that contract, or I wanted something from a friend, or whatever it is. I did not get it. And I'm feeling sad. But my motivation is still there. I want to overcome. I want to get better. I want to struggle. In which case, it is only sadness. And sadness is an emotion. एहसास है. Sadness can go away momentarily also. I'm feeling very sad because of that setback. Suddenly I get a call and somebody says, कि यार तेरे को एक दूसरा contract मिल रहा है, you're getting some other opportunity. Sadness is gone. Within a second it is gone, and now I'm feeling positive again. So let's not confuse sadness and depression. Sadness happens to anybody, anytime, and it can pass away. Any emotion can pass away. Even happiness. I can feel very happy for some time and then again go down back to normal. So whether I'm happy, whether I'm sad, anger, le lijiye, such a crucial emotion. Somebody can be very angry, but if he knows how to manage that emotion, it can pass off in no time. So sadness is only an emotion. It can come, it can go, it can be there for some time, it can be momentary, but it does not affect my way of life. On the other hand, we define depression as a state of mind where I start becoming dysfunctional. In psychiatric language, they call it anhedonia, A-N-H-E-D-Y-N-O-I, anhedonia. Anhedonia, very simple terms I'll explain to you, is when I lose motivation, desire, when I don't take care of my basic needs, when I know that I can do something about it, but still I don't have the mental and physical energy to do anything about it. That is when we call it as anhedonia, and that leads to depression. That is a symptom. The basic symptom of depression is when I'm not only feeling sad, but I'm also feeling loss of motivation. I become pessimistic. नहीं, कुछ नहीं होने वाला है, कोई फायदा नहीं है, आगे भी चल के सिर्फ बुरी चीजें होने वाले हैं मेरे साथ, मुझे उम्मीद घट गई है मेरी. Hope goes down. When all these factors come in and the person becomes dysfunctional, then we can say, yes, it is depression. Okay. There are different forms of depression. Again, I said, I'm not going into the clinical part of it. We're talking as average general human beings, not as mental health professionals or therapists or psychiatrists. So I would like to just differentiate between two types of depression, which can be of importance to us as ordinary lay people. One is endogenous depression, ENDOGENOUS, endogenous depression. The other is reactive depression. As the words suggest, endogenous is from within. There is something wrong in my brain chemistry. Nobody has done anything to me. There's no setback. There's no failure. There is no cheating. There is nothing has happened to me. But somewhere my brain chemistry starts getting altered and I start going into depression. A lot of endogenous depression also has a genetic element. Given grandfather had it, father had it, then the son or daughter has it. So endogenous depression, as I said, does not have a cause, at least not an external cause. But the good news is endogenous depression responds very well to medication. If you come across somebody who is feeling depressed for a very long time, and you have explored every possible reason for it, and the reason may not be one particular factor, it may be a string of factors. बचपन में मेरे साथ ऐसा ऐसा हुआ था, which pulled me down. Then when I grew up, I had something else which made me feel very upset. Then 5 years back, this happened. Then 6 months back, this happened. Yesterday, this happened. So there can be a culmination. Now, what happened yesterday may not be a major thing. That's one thing that happens when a person goes into depression. People don't understand. People generally label a depressed person as lazy. अरे उठो यार, करो काम, क्या है बेकार बैठे हैं तुम? नहीं, मेरा मन नहीं हो रहा. क्यों, क्या हो रहा? क्या हो गया तुमको? कोई कुछ किया तुमको? Is there any threat to you? Is there anything going wrong? No? Then why are you sitting like this? Why can't you get up? Why can't you do this? Come on, have a bath. Wear clean clothes. चलो काम पे लगो. नहीं, मेरे से नहीं हो रहा. See, he has become lazy. Now that is the worst thing to do to a person with depression. It is like if I have a physical ailment, if I'm having heavy fever and I'm sick, and people are saying, "Utho, you're lazy. Chalo, काम करो." But the thing is that physical ailment people understand. Somebody will stop and say, "नहीं यार, उसको fever है. He's got high fever. He's got a cough, cold. जो भी है उसको. So let him be. Let him take rest. Even if he says, "I want to work," they say, "नहीं, नहीं, नहीं, take rest." Here is the other way around. Because mental health issues are not visible. Physical health issues are visible straight away. And there are diagnostic tools. Fever, thermometer. हर घर में एक thermometer है. लगाओ, देख लो. And you know what is the fever. Cough, running nose are very, very visible. You don't need anything. High blood pressure. Many houses now have that electronic blood pressure apparatus. आपको डॉक्टर के पास जाने की भी जरूरत नहीं है. You test it yourself. हाँ, blood pressure should have been 120/80. It is 150/100. That means this person is suffering from high blood pressure. Therefore, this is this. Blood sugar. Everything has got diagnostics. Everything can be ascertained very easily. That is why people believe it. But in mental health, unfortunately, there's no diagnostics. So if I say that I want to go to work, I want to get up and be functional, but I am not being able to do it, nobody understands. So that was my first request to all of you. कि कभी भी अगर ऐसा कोई शख्स दिखे who used to be normal, who used to be functional, who used to be doing everything that he is responsible for, but at some point he starts going down, down, down. Please understand that it could be possibly depressed, possibly. But we'll go deeper into it. As I said, some causes can be a culmination of many factors that happen, not just one. I always give a lot of emphasis to childhood. Anybody who has had a bad childhood, for whatever reason, parents were bad, teachers were bad, there was some trauma that the child went through, the child felt insecure, the child lost some near and dear, a parent or grandparent or whatever it is, the child gets traumatized. Child doesn't know how to express it. The child grows up. If some more things have, nothing else happens, the child can then get back to adult life, functional life, and take up responsibilities. But supposing some more things happen to the child, I mean the adult who has grown up now, but by itself, none of them are serious. So people say, "Oh, you lost your job. इसलिए डिप्रेशन हो रहा है." अरे क्या यार, it's okay, everybody loses job. 5 years back I had also lost my job. I had to struggle for 3 months. I did it and I came back. Now what are you worried about? They even go to the extent that my grandfather died, दादा का इंतकाल हो गया. अरे उम्र हो गई थी यार, you were 92 years of age. What do you expect? चलो कोई बात नहीं, हो गया, भरोसा रखो अल्लाह पे, चलो आगे बढ़ो, ऐसा क्यों मायूस होकर बैठ गए हो तुम? That's what people tell. And that is a very cruel thing to do, because reactive depression can be a culmination of a lot of things. Acha, as I was telling you, endogenous depression and reactive depression. How do we know that it has come to a stage where you need professional help. I told you in the first instance, if I have that, courage, that faith, deen pe bharosa ho, jo bhi ho, I can pick myself up. If I can't do it by myself, if I have near and dear family members, close friends who are there to give me that support, the same way as if I have a problem with my leg and I'm not being able to walk and my leg is paining very badly, if somebody comes and holds the hand and says, chalo, मैं तुमको भरोसा देता हूं, मैं तुम्हारा बैसाखी बनता हूं, चलो, it becomes so much easier to walk, isn't it? So that is what we need. A person can come back with that. Supposing that doesn't happen, then comes what we call as counseling or psychotherapy. What is psychotherapy? Psych is the mind. Therapy is healing of the mind. And that is what counseling does. So a person who is going through this, he has not been able to take care of himself. He has not been able to take the help of family members or close friends, and still he is in that position. The next step would be to get this person to a neutral person who has nothing to do with him, who does not take sides. And that person can help the healing of the mind and for the person to come up to at least near normalcy or whatever it is. Okay. How counseling and psychotherapy works, I'll tell you in a minute. उस बीच में ये है कि supposing a person becomes dysfunctional. Now, what do I mean by dysfunctional? I'm supposed to be working in an organization. I feel so low that I don't feel like getting up and going to work. So I call my boss and I say, sorry, I'm not up to it. Please grant me leave. I'm a good employee. My boss likes me. So he said, ठीक है, ले लो एक हफ्ता छुट्टी ले लो. I'll expect you back next Monday. Okay. This whole week I spend at home. I'm feeling low. I don't want to get involved in any entertainment, any activities. I don't do anything. And the next Monday I find I'm still not in a position to go back to office. I inform my boss. This time he's a little irritated. Yeah, you asked for 1 week's leave and I gave it to you without any hesitation. Kya ho raha hai? How long do you want this leave? There's so much work pending. No, sir, I'm not in that position. Please extend my leave. Okay, I'm extending your leave for 1 more week. Next Monday, you have to be back. There's so much work pending. Okay, I'll be back definitely. I make all the efforts. I try my level best. But next Monday, I get up with the intention of going to office. And I find I do not have the mental and physical energy to go. This time when I call my boss, he says, no, bahut ho gaya. If you do not join back this week, you can forget about your job. No, I want the job. I need the job. But I'm not able to pull myself to go and function. So I have become dysfunctional. Now, it need not be only work related. At home, I stopped talking to my family members. बिल्कुल कोने में जाके मैं अकेले बैठा हुआ हूं, किसी से बात नहीं कर रहा हूं. People come and offer me something. चलिए हम चाय बनाए, हमारे साथ बैठ के चाय पीजिए. नहीं, तुम लोग पियो, मैं नहीं पीऊंगा. Some guest has come. आइए ना, बैठिए, we'll just talk to him. No, I don't want to talk to him. You send him away. There may come a point where my family members may feel कि यार इनके साथ रहने से क्या फायदा है? He's not talking, he's not participating in anything, he's not doing anything. So here again, there can be a dysfunctionality. Now, if the dysfunctionality persists for a time period long enough to cause irreversible damage. In the first case, what was the damage? Loss of job. In the second case, what was the damage? Loss of relationship. I know that I'm going to lose my job. I know that I'm going to lose my relationship, but still I can't bring myself to come. Now that is when we label it as clinical depression. And that is when a person needs psychiatric help. Now, here again is a very, very sensitive matter. Okay, people just do not like to see a psychiatrist. There is so much of stigma. People feel antidepressant medicine is horrible. It is addictive. You have to take lifelong. It has very bad side effects. लोग क्यों बोलते हैं बताऊं मैं आपको, क्योंकि that is how it was 20, 30, 40, 50 years back. But medical science has progressed immensely. Today we have very effective antidepressant medicine. But of course, it should be prescribed by either a psychiatrist or a physician who is knowledgeable in mental health issues. Once it is prescribed by a competent person, professional, then the person takes antidepressants. And in most cases, it is not addictive. Once the condition improves slightly, the doctor himself will say, okay, you can now start, reducing the dosage. I will taper it off 1 month, 2 months, 3 months, whatever it is. Now you can stop. Come back after a few months, we'll review again. If you're feeling all right or if you're feeling low, come back immediately. We'll see if there is again a need for medication. So that is the dividing line. If you feel that a person has become dysfunctional for a sufficient period of time that it can cause irreversible damage, please understand that this person needs professional help. If that is not the case, the person is in depression, but he's somehow forcing himself to go to office. He's doing his work. Or he's playing with the children, he's talking to this thing. But deep down inside, he's feeling very, very low. That is when the person needs counseling or psychotherapy. He doesn't need medication necessarily. The emotional support which is given to the person can play a very, very major role in overcoming it. And what is this psychotherapy or emotional support, या जो भी आप बोल दीजिए? It is very simple. First thing is, as I told you, do not criticize. Do not put down the person saying that you are lazy. Come on, get up, chalo, आगे बढ़ो, ये करो, वो करो. नहीं, it doesn't work. You have to accept it. If you want to be successfully pulling that person up, the first thing that you have to do is to accept it and say, I understand that you're going through a very bad phase. You're a very responsible person, but you're not able to fulfill your obligations because of something that is happening inside your mind, and let us together work towards it. Then what do? Hear him out, particularly in reactive depression. What were the circumstances? In fact, what I do is I even ask him, not only what happened to you last week or last month, tell me all that has happened to you throughout your life. Every time something bad happened, it is piling up, piling up, piling up. Stress is increasing. Then it comes to a point where the person gets pulled down and he goes off into depression. You'll be amazed to know that depression is the most common mental disorder. Even though we don't want to label it as a mental disorder, it is a fact that it's a mental disorder. The same way as perhaps fever or common cold is the most common physical illness. But the difference is there we accept it. Here we don't. There are various estimates that show that at any given time, maybe 20 to 30% of the population suffer from some form of depression or the other. The main thing is to acknowledge, accept, and start moving towards doing what is needed for the person to come back towards normalcy. So like I told you, first thing is no criticizing, no putting the person down, accepting, acknowledging, and saying, okay, yes, you are going through. The next is to try to see whether whatever daily routine he is capable of doing in that mental state, allow him to do it. एटलीस्ट आके बैठो, नहीं मुझे भूख नहीं लग रही है, मुझे खाना नहीं है, कोई बात नहीं, आके आप बैठिए हमारे साथ, वी विल ईट, वी विल जस्ट चैट विथ यू। अगर आपको मन लगे थोड़ा आप भी खा लीजिए, नहीं अगर बिल्कुल मन नहीं लग रहा कोई बात नहीं, बट जस्ट कम एंड सिट विथ अस, maybe have a cup of tea with us. So you see, you're getting the person back into some form of routine. The person is told कि फलानी चीज घर में नहीं है, आप जरा दुकान तक जाएंगे और वो खरीद के ला लेंगे आप। Give him something very small to do. Ask him whether he is interested in going for a walk. He says, नहीं मेरे को बिल्कुल मन नहीं हो रहा, I mean, I don't feel like going out. कोई बात नहीं, आप टेरेस पे वॉक कर लीजिए, घर के अंदर वॉक कर लीजिए। Because remember one very important thing, the mind and body are totally interconnected to each other. Good body leads towards a good mind, and a good mind leads towards a good body. So whatever, सबसे पहली चीज तो न्यूट्रिशन, ग़िज़ा, in some form, in whatever form, person should be encouraged to continue with nutrition. Otherwise things can go very bad. Similarly, the person needs some form of exercise. People in depression generally turn to only sit in one place. That's not good. Hygiene, whatever is the bare minimum hygiene, at least maintain that and continue to do that. Then instead of setting long-term goals, try and set some short-term goals. कि ये छोटा सा काम कर दीजिए। ये लड़का है घर में, he's having trouble with maths, third standard mathematics, he's not being able to cope. चूंकि आप घर पे हैं, will you just help him with the homework? Because he really needs it, otherwise teacher is scolding him, he may fail in the test. So it will be really good. And whenever the person rises to the occasion and agrees to push himself to do it, whether it is going to the shop and buying something, or whether it is helping the child with the tuition, give the person a lot of positive strokes. Then, as things start improving a little bit, now slowly get the person back to what was the reason, what were the factors. Even if it was something which happened long back, have you been able to resolve it emotionally and mentally? I lost my grandmother, whom I loved very much. I was truly and fully attached to her. When she passed away, I felt very, very sad. But when did that happen? 12 years back. अरे क्या यार, 12 साल हो गए, चलो आगे बढ़ो, ठीक है कि हयात उतनी थी, अल्लाह के पास चले गए हैं, और क्या कर सकते हैं अपन, अब आगे बढ़ो। नहीं, if I have not been able to resolve that in my mind, it will keep hitting me. When that boss had shouted at me, when that teacher had shouted at me when I was a child, list it out and help the person to resolve each of them one by one at a mental or emotional level. Some of them cannot get resolved so easily, doesn't matter. Work on those which can be resolved, which can be taken into account. Along with that, every one of us has got our own ways and means of relaxation. Some people like to go for a walk, some people like to go to the gym, some people like to do gardening, some people like to do something else. Any form of relaxation exercise which suits the person. And there again, if the person can be given a purpose, that plays a very important role. Whenever I'm depressed, I start thinking, I am not serving any purpose. मेरी जिंदगी का मकसद ही क्या रह गया? What am I contributing by being here in this world? That is how I start thinking. So, as I said, very short, very minimal goals which give me a sense of purpose. उस छोटे बच्चे को पार्क को लेके जाना है, कोई नहीं है उसको ले जाने के लिए, यहीं पास में है पार्क, just go sit on the bench, he will play around for 15 minutes, half an hour, bring him back. If you want, take a book or something with you, sit and read while he is playing over there. Very easily done. He doesn't have to face anybody. He doesn't have to prove himself to anybody. But he feels that there is a purpose to my life, because there was nobody to take this child to the park, and I took the child to the park. Ammi ki tabiyat kharab hai. Some medicine is needed. We have suddenly run out of medicine. Bhaiya, aap leke aa jaiye na, please. We don't know which shop, where it can be. I think you know better. You can inquire and find out where and how, and get that medicine. You go and get that medicine. Ammi medicine le liya, she's feeling better. Again, that purpose comes back. So very small things in terms of relaxation and in terms of giving a meaning and a purpose to life at a very minimal level. Then the other thing is, as you know very well, people who get into depression like to keep away from people. जो रूटीन में भी कर रहे थे वो नहीं करते, मस्जिद में जाके नमाज पढ़ते थे, अब घर में पढ़ रहे, या गए भी तो फौरन जैसे जमात खत्म हुई निकल के आ गए. I don't want to meet people, I don't want to talk to them. Most people, when they are into depression, they want to keep away from people. Okay, now don't force them to get involved with people, but start with one person at a time. Identify one person with whom he is comfortable. Request that person to come and spend some time with him, and maybe in a way that makes him feel important. कि भाई साहब ये मेरे को थोड़ा कंफ्यूजन हो रहा था इसका, आई वाज नॉट एबल टू रिजॉल्व, ये मेरे समझ के थोड़ा बाहर है, आप थोड़ा ये समझा देंगे मेरे को. 5-10 minutes he sits and explains whatever is his area of expertise or understanding. Praise him, thank you so much, आपकी वजह से ये समझ में आ गया, मेरे को मेरा मसला हल हो गया, बहुत बहुत शुक्रिया. Go away. Next time he will welcome another person. But it is very important that the person starts interacting with people, and equally important, interacting by helping others. मैं आपको मिसाल देता हूँ. हमारे बंजारा एकेडमी में एक सर्विस विंग है जिसको हम कहते हैं हेल्पिंग हैंड्स. हम क्या करते हैं उसमें कि बड़े बड़े हॉस्पिटल्स जो हैं उसमें हमारा एक हेल्प, मे आई हेल्प यू डेस्क है. वहां पर हमारे वॉलंटियर्स बैठे रहते हैं. Who are these volunteers? Very ordinary people, not doctors, nothing to do with medicine. A very poor man comes, उसको फॉर्म फिलअप करना है, he doesn't know how to read and write. आओ यहाँ हम तुम्हारा फॉर्म फिलअप करके दे देते हैं, ले जाओ. Another person comes and says, मेरे को आंख में तकलीफ हो रही, कौन सा डिपार्टमेंट में जाना है, कुछ ऑप्थेल्मोलॉजी कुछ बोल रहे थे, मुझे समझ में नहीं आ रहा, चलो मैं समझाता हूँ. वहां जाओ, तीसरा कमरा राइट साइड पे दिख रहा है ना, वहां पर एक सिस्टर बैठी है, उनसे जाके बोलो कि आंख की तकलीफ है, वो तुम्हारा मसला हल कर देंगे. So this volunteering that we do, we have found to many people who are feeling down and out, who are feeling lonely, who are feeling that there's no purpose. Many people after retirement also it happens. They can become lonely, they can even get into depression because they feel that I am no longer worthy. अब तक जब तक मैं काम कर रहा था तो I was somebody. Now I've lost my designation, I've lost my income, I've lost my status. So here it gets redeemed. तो मैंने क्या किया है कि in this short session, I've tried to give you as many very basic, simple tips as seeds to be germinated. Now I want you to expand from there. You can find your own ways of doing it, provided you give cognizance to what I have said. मैंने जितने भी चीजें आपको बताई हैं उसमें से आप चुन के लीजिए जो आपके लिए मुनासिब हो. But most important, as I told you in the beginning, and I'm repeating again as I end my first part of the session, please be aware whenever anybody around you, be it a neighbor, be it a relative, be it a friend, be it a colleague in office, if they go through depression, please help them, because depression is curable and depression can prevent the person from going into more and more serious disorders and more complications and difficulties. It can be set right. It is like if a person has a cold or fever and all that. If you neglect it, it can become pneumonia. Then it can become life-threatening. उसी तरीके से if we can prevent it, and depression, as I told you, barring very extreme clinical depressions, can be taken care of by you and me if we follow these basic guidelines or these basic principles. So that was my simple message to you. अब आप बताइए आपके क्या सवालात हैं, कमेंट्स हैं, agreement, disagreement, anything is there, please put it up on the chat box. I will try to answer as many as possible, and then we'll see where it leads us to.
Thank you, Ali sir. Thanks all. So we have a poll now. Just I want everyone, I'll just launch the poll. So please answer that. We'll give 2 minutes on this. Everyone might have got the poll on their screen. Request the people to participate in it. Meanwhile, लोग ये भी कर सकते हैं. I mean, they can ask the question in the chat. So we'll give 2 minutes for this poll. Sure. Thank you.
I can see in the participants list that there are so many people who are doing excellent work, who themselves are contributing to society in so many ways. So I'm sure you have something to add on to what I have said. Please feel free. In the realm of mental health, there is no rules and regulations. We have to adapt to situations and we have to adapt to people. So I may be saying something, you may have something much more meaningful to add, or you may have a doubt about what I have said. Please feel free. Let us have an open discussion. Yes, there is a comment here. Is it better to avoid triggers that lead to depression? Yes. Whenever you know that there is a person who is prone to depression, that he could possibly lead on to depression, or he's already into a little bit of depression, please avoid triggers. What do we mean by triggers? A student, for example, who's already feeling very low, very tense, anxious, very anxious, he may even have had some panic attacks. Now, if he is made to undergo some testing or some exam which is very, very competitive, very, very difficult, that can act as a trigger. No, I cannot do it. I cannot compete. I cannot succeed. And the person may go all the way, down. OCD के बारे में बताइए. OCD है obsessive compulsive disorder. It is not necessarily related directly to depression, but it is a very common and a minor mental health disorder. Obsession यानी किसी चीज के साथ जो है जहन वहीं पर आके अटक जाता है कि I am only obsessed with taking care of my child. I am only obsessed with washing my hands. I am only obsessed with the security of my house कि मैंने लॉक बराबर किया या नहीं किया. Now, obsession can happen to anybody. It is not a disorder unless it becomes compulsive. OCD. Obsession हुआ. If that obsession leads to compulsion, मैं घर से निकल गया लॉक करके, I come running back to check whether I've locked it or not. I go another few steps. Again, I come back to see third time whether I've locked it or not. Have I switched off the gas or not? I will again open, go back into the kitchen, again check that thing. मैं अच्छा हाथ मुंह धोके निकला था. I just go and touch this table and I get a feeling कि कोई germs तो नहीं है इसमें. I think I'll go and wash my hands again. So there are people who keep washing their hands throughout the day. So when it comes to that compulsion, which again, as I said, starts affecting the person, his functionality and all that, then it is a disorder. The D comes in, obsessive compulsive disorder. Such people can be helped by a combination of medication and psychotherapy. How do caregivers cope with mental health issues? That's a very, very important point. I am glad that you asked. I am very strongly a believer that you should take care of yourself. अगर आप हवाई जहाज से travel करते हैं, तो the air hostess tells that if there is a drop in the oxygen pressure, the oxygen mask will drop down automatically. Put it to your face and breathe normally. And then she says, if you are helping a child or an old person to put on the oxygen mask, first put on your own oxygen mask. क्योंकि मैं अगर दूसरे के ऑक्सीजन मास्क पहनाने में वक्त गवा दूं, I may become breathless. I may lose consciousness. So put on the oxygen mask first. Exactly the same thing we need to do when it comes to mental health issues. First, take care of yourself. Am I being functional? Am I giving up my own needs and wants? Am I allowing my work or vocation to be affected? Am I spoiling my relationship with others because I'm all the time concerned about this person who's going through depression or mental health issues? So please keep a balance. It has to be done. In fact, one of the worst mental health disorders, which is called Alzheimer's, dementia, that is perhaps the last frontier of medical science. We still do not have a cure for dementia. And that is why caretakers have to be really careful. It can go on for years. So I have compiled a handbook for caregivers of dementia. अगर आपके फैमिली में, अगर आपके घर में अगर कोई ऐसा हो जिसको Alzheimer's disease हो, so how do you take care of yourself when you are taking care? The doctors will tell you how to take care of the patient, but how do you take care of yourself? Now that I don't sell, I give it free to anybody who is going through this sort of thing. If you can just send me an email at alikhwaja50@gmail.com, I will send it to you. The spelling is alikhwaja50@gmail.com. आप उसको चैट बॉक्स में डाल देंगे. So anybody who is undergoing this sort of thing, if you're a caregiver, I would like to contribute in my own humble way by sending you this caregiver's handbook. Okay. If a person suffers from hyperactivity in childhood, him going to depression, is it a most common cause? No, nothing like that. To my knowledge, has been identified that people who are hyperactive in childhood lead to depression. I have not so far come across any research which connects the two. Mental health is considered a stigma which needs to be addressed at the earliest. We need to train every human to become a lay counselor, create awareness program like these, and encourage lay counselors. Absolutely. That is what we are doing. That is our mission in Banjara Academy. जो भी हमारे पास आता है, one is we provide free counseling to anybody for any issue, emotional, mental, interpersonal, relationship issues, work-related issues. So in our own way, we are contributing by providing free counseling, not only by, in person, because people cannot travel and come all the way to Artinagar, by phone and by email. So if you can get onto our website, which is banjaraacademy.org. Banjara Academy is one word, BANJARAACADEMY.org. हाँ, this is another question. हम कैसे समझे कि कोई इंसान सैड है या डिप्रेशन में है, कैसे डिफाइन करेंगे? मैंने आपको बताया, मैं फिर रिपीट कर रहा हूँ कि सैड जो इंसान है वो फंक्शनल होता है, उसकी उम्मीद नहीं खोती. वो बोलता है कि मुझे बहुत मायूसी हो रही है, लेकिन मुझे काम करना है, मुझे दफ्तर जाना है, ये कोई खातून है, मुझे बच्चों के लिए खाना पकाना है, मैं बहुत मायूस हूँ, लेकिन मैं कर रहा हूँ. द डिफरेंस कम्स इन डिप्रेशन कब होता है कि जब वो जानता है, वो खातून जानती है कि मुझे बच्चों को पका के खिलाना है, लेकिन मेरे में वो जुस्तजू ही नहीं रही, मेंटल एंड फिजिकल एनर्जी नहीं रही. अरे कुछ होटल से मंगा के खिला दो यार बच्चों को, मेरे से उठे नहीं जा रहा है, मेरे से नहीं हो रहा है, या मैं ऑफिस नहीं जा सक रहा. सो दैट इज द डिवाइडिंग लाइन कि ये शख्स जो मायूस है, सैड है, क्या वो फंक्शनल है या डिसफंक्शनल? टू सम एक्सटेंट आल्सो फंक्शनल. ही मे नॉट बी 100% फंक्शनल, लेकिन जितना भी मिनिमम, यार मैं पहले बहुत अच्छा खाना बनाती थी, अब मैं बेसिक खाना बना के दे देती हूँ बच्चों को क्योंकि आई एम फीलिंग वेरी सैड और आई एम फीलिंग वेरी अपसेट. दैट इज हाउ वी डिफरेंशिएट.
So there is a question where they are asking कि differentiate between sad and depression. इसका difference क्या है?
वही तो बताया मैं अभी कि a sad person is not dysfunctional. Person मायूस हो गया है, उसको गम है, लेकिन वो अपने जिम्मेदारी या अपने जो डे टू डे एक्टिविटीज है वो जारी रखता है. डिप्रेशन कब है? जब वो कोशिश करने पर भी, नियत करने पर भी जो बेसिक फंक्शंस हैं वो नहीं कर पा रहा है। अभी मैं वही मिसाल दिया कि खातून है जो बच्चों को खाना पका के खिलाती है, लेकिन वो नहीं खिला सक रही है। बच्चों से मोहब्बत है उसको, बच्चों की फिक्र है उसको, लेकिन वो नहीं पका सक रही है। That is when you say that it is depression and it is not just sadness. If she can get up and take care of the children, at least the minimum amount, then it is not depression, it is sadness. There's another question. How can we come out of insomnia? Insomnia यानी नींद। अगर किसी को नींद नहीं आ रही है, हाँ, दैट्स अ गुड क्वेश्चन। अब मुझे याद आया कि इफ ए पर्सन गोज टू स्लीप, आप अपना दिन का काम खत्म किए, अपना जो मुकर्रर वक्त है उस पर आप जाके लेट गए और सो गए, एंड यू गो टू स्लीप. If you wake up in the middle of the night and cannot go back to sleep for a long time, it takes you 1 hour, 2 hours, 3 hours, 4 hours. फिर थकन के साथ आप सो जाते हैं, फिर सुबह उठ जाते हैं. This is called middle insomnia. Middle insomnia is an indicator of depression. Whereas a person who cannot sleep at all, जाके लेट जाता है लेकिन ख्यालात कुछ ऐसे होना शुरू करते हैं जिसकी वजह से नींद उसकी थक गया है, उसको नींद आ भी रही है, but the thoughts are keeping him awake. That is not depression. That needs to resolve the problems. He's under stress. If a person goes to sleep and has a full night sleep, almost a full night sleep, 6 बजे फजर में उठना चाहिए था लेकिन 4:30 को उठ जा रहा है, that is also not depression. That means somewhere his life, sleep is complete. People don't necessarily need 8 hours of sleep. So maybe earlier he was sleeping for 8 hours. अब उसको 6 घंटे की नींद भी काफी, as long as he wakes up with a fresh mind. See, insomnia has to be looked into in that effect. Not सिर्फ quantity and quality of the sleep, but how does a person wake up? अगर उठने पर भी he still feels very tired, जैसे कि मैं सोया ही नहीं हूँ, then we need to look into it. Not necessarily depression, but there is something which needs to be looked into, and this has to be looked into at an individual level. So like I said, anybody having these type of issues, they can either come over or they can write to us. We will understand the person holistically and then guide the person what you should be doing about it. Can you suggest any book to understand this topic of depression in a more and better manner? I don't want to sound as though I am trying to push something. I have written a book. It's a very small, practical workbook for dealing with depression. It costs only 50 rupees. It is available in our office. I just told you our website, banjaraacademy.org. So knowing that people today don't read books which are 200, 300 pages and cost also, आजकल किताबें जो है 400, 600, 800 से कम नहीं होती है. So that's why I've condensed it to the bare minimum of what practically a person needs to do to deal with depression, and what are the steps and how, whatever I've told you now, in a more elaborate manner, in a form of exercises and activities and all that. So if you can pick up a copy, we give both hard copies and soft copies as per the request of the buyer. You can pick up that. Of course, there are much more deeper and much more, knowledgeable books on depression, but that takes a lot of, severe reading. आजकल लोगों के पास उतनी फुर्सत नहीं है और उतना पैसा भी नहीं है उतने एक्सपेंसिव बुक्स खरीदना और उतने सारे पेजेस पढ़ना and all that. But if you are the type of person who wants to read, please send me an email. I'll send you a list of very, very knowledgeable books on depression. If you are really interested, you can buy those for yourself and you can read them up. Community lacks the right reading of depression. The healthier people need to know the behavior. Am I right? Absolutely right. People who do not have mental health issues, that I told you, they label people. He has become lazy. बेकार हो गया, देखो काम नहीं कर रहा है, ये नहीं कर रहा है, पढ़ाई नहीं कर रहा है, देखो ये औरत बच्चों के लिए खाना नहीं पका रही है. That is what happens because you have not experienced it. You don't know what is going on in the other person's mind. But as somebody suggested right now, if we can create awareness, if we can spread the word, those who have followed today's program, and I'm very happy that so many of you took the trouble, though it is late in the night, you have taken the trouble to log in and to attend this thing. Please spread this message. Is there any helpline number for Bandara Academy to call Bandara Academy? Yes. 88617 88617 92260. There's another number, 88614 88614 21666. These are our headline numbers. 9:30 to 5:30 Monday to Saturday. कभी भी आप फोन कीजिए. Inshallah, there are always some counselor or the other available. People who speak different languages. We have counselors who speak English, Urdu, Kannada, Hindi, different languages. So whichever you and whatever you are comfortable with, and it is 100% confidential. That much I can assure you. Okay, and you don't even have to disclose your identity or anything like that. You can take whatever help we can give from our side. If it gets very serious, we ourselves will tell you if you need professional or psychiatric help or something like that. We will guide you to that. How about adjunctive therapies like muscle relaxation or psychotherapy? Psychotherapy is what I've been talking about. Counseling and psychotherapy is one and the same. Psych is the mind, therapy is to heal the mind. But yes, when you mention things like muscle relaxation, you remember I told you physical exercise, stretching exercises, all these breathing exercises. नमाज में खुद आप देखते होंगे कि how it is recommended कि आप सांस कब अंदर लेते हैं और कब आप सांस बाहर निकालते हैं. That itself is a therapeutic thing. उससे हटके भी you can do it. I even tell students, who are facing now, exams are coming up, I tell them do deep breathing, slow and deep breathing. Stretch out your hand this way, उठ के खड़े हो, jump up and down and sit down and again study. The same thing you can recommend to people who are tired, who are stressed out, who are undergoing depression or even sadness. Physical rejuvenation contributes towards mental wellness. What else is there? How about bipolar syndrome? Can it be cured? Bipolar syndrome is a serious mental disorder. It needs psychiatric intervention. Yes, it can be cured. Today we have very good medication if the person is brought for treatment at the early stage. The same way as medicine has progressed in cancer, anybody who's in the first stage of cancer, there's a 90% chance that the person can be healed. But if you ignore it and you bring to the doctor when he's in fourth stage of cancer, chances of recovery are very poor. The same thing happens with major mental disorders like bipolar disorder. Which vitamin helps OCD? No, I have not come across any particular vitamin that helps. But things like vitamin B complex and all that can be taken safely for any person for any situation.
Yeah.
Where is your clinic? Can you please provide details? We are in Nagar, not far from the place where we are now, right now, Jamaat Islami Hind. Our exact address is given in our website, bandaraacademy.org. आपकी बात मुकम्मल तौर पर प्रॉफेट मोहम्मद की टीचिंग के मुताबिक है. अल्हम्दुलिल्लाह, बहुत बहुत शुक्रिया, जज़ाकल्लाह. मेरे तरफ से जो बहुत ही अदना लेवल पर जो कुछ भी मैं कर सकता हूँ मैं कर रहा हूँ. हमारी टीम है, very dedicated volunteers and counselors. We are doing whatever we can. Rahmat Hussain Saab is showing his hand. Please ask your question.
I mean, we have just 1 minute left. Thanks a lot, sir. Alhamdulillah, it is a wonderful session. Allah ka fazal karam. So we are at the last. So I'll just once again introduce this webinar as organized by Solidarity Youth Movement Karnataka, which is a social civil movement working for empowerment of youth in various sectors, be it economic empowerment, social empowerment, political empowerment, or spiritual empowerment. Also, we work on resolving youth issues and social issues. And this is one as such part of our initiative. So going forward from next month onwards, we will have every month, first Saturday, 9 to 10, we'll have different topics related to social issues and all. So I request everyone to participate in it. And thanks a lot for attending these sessions. Jazakallah, Jazakallah, Humma wa khairun ahsanul jaza. Assalamu alaikum warahmatullahi wabarakatuh.
Walaikum assalam.